that we are accounting nowadays. Tooth decay is a communicable disease that majorly affects our teeth. It can be transmitted from one person to another if at all you're doing some of the bad things like sharing your toothbrushes, sharing some kind of the sweets. Those are some of the ways through which this disease can be transmitted from one person to another. Then we are going to talk about its causes or its predisposing factors. Here, where some of the causes of this tooth decay is going to be poor oral hygiene. First of all, I told you that tooth decay is majorly associated with 4 factors. One is going to be your tooth, isn't it? Your tooth. And then away from your tooth, we are going to talk about the food particles that do stuck in our teeth. Then we are also going to talk about the food and then the microorganisms. When I talk about the microorganisms, we are majorly meaning the bacteria. We have those microorganisms that stay symbiotically in our mouths. Those ones, they don't eat anything else apart from those food particles. The moment they eat or they ferment those food particles, they produce acids. It is these acids that goes on to burn our teeth until when the holes or the cavities are formed. But a cavity or a hole or a tooth with a hole, it is not going to cause anything like pain until when, or not until when, it have reached the pulp, which is the reading part of the tooth. So we shall tell you more other causes. Then one of the predisposing factors to these dental caries is just going to be poor oral hygiene. The moment you cannot maintain your oral hygiene well, for example, by proper brushing, by flossing, you're not removing these food particles. So they are going to harden and they are going to provide these bacteria or these microorganisms which do stay in our mouths, food, and so acids are going to be much and then they are going to continue burning our teeth. Then other factors are going to be, of course, the kind of food that you eat. If you really use more sugary food products, you are on high risk of getting this kind of dental caries than this person who consumes less sugary foods. Then we can also talk about practices like smoking. Smoking is going to bring a lot of stains on our teeth. When these stains are on our teeth, they help other food particles adhere properly on the tooth as well. So it provides these bacteria or these microorganisms with what to eat and so cause acids that will burn our teeth, as we are telling you. Then still we are talking about poor nutrition. So long as you cannot eat a well-balanced diet, you are not providing your body with enough antibodies to fight against these kind of microorganisms or these bacteria that do cause dental diseases. Then we are also going to talk about not flossing. Flosses are some thread-like instruments that are used to remove food particles in between our teeth. We encourage people to go ahead and buy flosses that are going to ensure a proper cleaning. Then still, if someone cannot, maybe we can talk about gender. Gender, as we talked about how dental caries or tooth decay affects more women than men, and then how it affects children than the adults. It is because the adults' teeth are more strong than the children's teeth because they are soft and they are not fully calcified. Then we are going to talk about factors like not using fluoridated toothpaste. Some of the toothpaste that are on the market, they do not contain fluoride as a content. So if you do use fluoride toothpaste, really, we do think that it can try to fight away this kind of acids that are produced by the bacteria in their process of eating food.